Well, good afternoon, everyone. Today is our September 30th COVID-19 update on behalf of the great city of Richmond. You know, tomorrow is October, and the city of Richmond is still in phase 3 of our Forward Virginia reopening plan. City of Richmond's government is also continues to be in phase 3 of our operating procedures. And if you have any questions about what city services you can access, visit richmondgov.com/COVID-19. Also, if you're unclear how Forward Virginia Phase 3 impacts or affects a small business that you normally patron, we ask that you visit rvastrong.org/reopening guidance. As of this morning, the Richmond City Health District is reporting 4,674 positive cases in the city of Richmond over the course of the last few months. 61 Richmond residents have lost their lives to COVID-19. Per usual, I'd like to take a moment of silence in respect and in honor of those who lost their lives. Thank you. Our weekly numbers should tell you that now is not the time to stop taking precautionary measures. If not for yourself, then the more at-risk members of the Richmond community. So please download COVID-Wise, the COVID-Wise app. If you have a smartphone, an iPhone, a Samsung, you name it, please download the COVID-Wise app. There you'll get a notification of exposure and then get tested. And when that happens, you're doing the whole city a favor. We all have a role to play. Also, we continue to offer free testing events in our community. Friday, October 2nd, from 1 to 4 p.m., there will be a free testing event at Eastern Henrico Health Department. You must register for this event, so don't forget to call 804-205-3501. Another reminder, masks remain mandatory in the city of Richmond. Mandatory. This is not an optional thing. You must wear your mask. And as we've seen from the CDC director, we've seen from our own local director and Dr. Avula, this is the greatest tool we have currently with a lack of a therapy or a vaccine into keeping the virus at bay, wearing your mask. Not just you personally, but everyone you know should be wearing a mask. And so I will be a broken record until the day we have a vaccine. That this is our number one tool we have at our disposal. And so I want to thank those who have been involved in distribution of masks in our community. I'm proud to announce today that the city distributed 29,000 masks just in the month of August. This is the same month that the mass distribution network launched here locally. Big thanks to the Richmond Fire Department, led by my friend, Chief Melvin Carter, for leading our efforts in distributing these masks to those who need it the most. And so if you are looking for a mask or looking to pick up some masks in the community, we ask that you go to rvastrong.org/get-a-mask. rvastrong.org/get-a-mask. Here's the deal. I know there's room for growth. Mask wearing is down in some communities because of cultural factors. So it's on us to take a culturally informed approach to this public health challenge. Namely, field reports and observations indicate that Richmond's Spanish-speaking communities haven't wholly embraced mask wearing. The health district has solicited input from our Latino leaders, partners who work with the Spanish-speaking community, community health workers, and experts in Hispanic marketing to identify a couple of themes driving low mask compliance in our community. Some of the themes that have come out of that research: first, misinformation about COVID-19 caused by mistrust in government, less access to medical care, and lack of Spanish language public health resources. Another tidbit we picked up was a cultural opposition to wearing masks due to machismo or fatalism, and the lack of enforcement of VDH guidelines on the part of restaurant and small business owners in our communities. So the health district and the city, namely the Office of Multicultural Affairs, will implement an educational campaign to address mask wearing by facilitating mask distributions, connecting with restaurants and small businesses to increase accountability, and using local influencers as trusted voices promoting mask wearing. In fact, I look forward to participating in a mask distribution later this week in a primarily Latino community. Dr. Avula has more information about that, and he'll talk about that effort probably in his remarks. I will likely join Dr. Avula on that effort. As we move into the true fall months with true fall weather, it's time to start facing the reality of celebrating holidays during a pandemic. Yes, we are in the last day of September. October is around the corner. And you know what comes with October is Halloween. So in the interest of health and safety of all Richmonders, this Halloween will not be like Halloweens of the past. The Virginia Department of Health has published guidance for Halloween events, and I expect everyone in our city to act in accordance with those guidelines. High-risk activities for Halloween include going to Halloween parties. Like I said, this won't be like Halloween of 2017 or 2019 even. This is the Halloween of 2020 in the middle of a pandemic. So include going to Halloween parties, going to haunted houses, hay rides, and trick-or-treating without wearing a mask or staying socially distanced. These are what are considered high-risk activities. So I strongly suggest nobody in the city put themselves or their community at risk by partaking in any of these high-risk activities. In accordance with this guidance, many neighborhood associations have already canceled their Halloween block parties. Just last week, Hanover Avenue said they will not be hosting their annual affair. West Avenue also stated such, and the Carver neighborhood as well. I want to take the time right now to thank them for their selfless, sensible decision, and I ask that other neighborhoods and communities in Richmond follow their lead. Recently, the Richmond City Health District suspended operations at 7 restaurants in the city for failure to meet health guidelines. Those suspensions were lifted after a corrective plan, action plan, and re-inspection. I have no doubt those same standards will apply for any private entity planning on hosting a Halloween event. My request is that we not get carried away. We all enjoy Halloween, but remember, we will be enjoying Halloween in a pandemic, a little bit different than Halloween of 2019 or years past. Business owners, I ask that you comply with these guidelines. And if you have questions about how to do so, the Health District is willing to be a resource for you moving forward. Let me be clear. I think it's best to stay home. That is what I will be doing on Halloween, staying home, not at a party or anything of the sort. But this is also an excellent opportunity for innovation as we adapt and adjust to this new normal during a pandemic. So this is how I think you could potentially innovate some of the traditional Halloween activities. Maybe, might not be bad to embrace a new tradition of maybe like pumpkin carving contests with your family on Halloween. Hold a virtual costume contest from the safety of your own home. A Zoom costume contest, a Microsoft Teams costume contest. There's a number of other platforms you can use as well. But once again, following the theme that we are safer at home, dressed up like Spider-Man or Black Panther, or, I don't know of any other costumes out there, but these are all options I'm giving to the public. Or maybe just we could benefit from the half-price candy the next day that you can pick up and enjoy for weeks and weeks on end in the comfort of your own home. Obviously, if you have any questions about what's safe, look up the VDH Halloween guidance. They're very thorough, as we want, and they're based in science and provide many alternatives to the traditional Halloween celebration. Dr. Vula is here to provide some more details of not only about Halloween, but where we are in our current health status as a city. So, Dr. Vula.
Good afternoon, everybody. So for the first time in a while, we as a region have actually moved in some good news in terms of the overall case counts and burden. The central region has moved from the high burden place that we were, the substantial transmission. We've moved down to a moderate burden of disease throughout the central region. Continue this fluctuating trend where we have not had sustained decreases across the region for 14 days. And so the overall grading for the central region is moderate community transmission. That's a change from the last few weeks. Richmond, the city, continues to be on the right trajectory. We're now 31 straight days of decreasing case counts, 24 straight days of decreasing percent positivity. Our current case rate is 7.7 per 100 cases per 100,000 residents. Our percent positivity is, our 7-day moving average is 3.1. So while those things are good, they're the right direction, I absolutely reiterate what the mayor is cautioning is that we need to keep things here. We need to get better. And us feeling like these numbers give us the license to sort of get back out there and attending parties and going to gatherings will just turn this right around. And I say that particularly in the context of the fall settling in, us heading into colder temperatures. People are going to spend more time inside, and that's how the virus transmits. The more time we are inside sharing airspace, not protecting ourselves through distance and mask wearing, the more likely it is that we will see sustained transmission. The other thing that we are all concerned about, and I've spoken about before, is the coming of flu season and the potential impact that simultaneous rates of flu and COVID have on our health systems. Our health systems are absolutely gearing up and preparing for what might come in terms of a surge. But it's important that we do our part as well. The same things that we are doing for COVID prevention also work for flu prevention, but we have the additional tool of flu vaccination that we don't yet have for COVID. The health department this Friday will be offering our first open to the public free flu vaccination event at the Southwood community from 4 p.m. to 6 p.m. Along with the mayor's comments about mask wearing in Spanish-speaking communities, this will be a dual event. We'll both be doing mass vaccination for the flu and mask distribution for COVID and flu prevention. And so we hope that you'll join us at 3:30 for that. More information to come tomorrow, Friday, in the Southwood community. The public mass vaccination starts at 4 o'clock. I want to just follow up the mayor's comments to our restaurant suspensions. The last few weeks have been challenging for folks trying to run those types of businesses, right? They are trying to make ends meet, to pay their staff, and to do this in a context of constantly changing information and constantly changing guidelines. We've done our best to communicate those clearly and to be really to engage our partners in the business community in a conversation around what those guidelines are, what we need to see happen. And it's really only in the cases where we have not seen compliance and have not seen positive movement that we've moved to suspension. Now, as the mayor said, in all of those cases, we received a corrective action plan, we re-inspected, we ensured that our staff was available to do that, and we were able to reopen those businesses. And so my plea to the community moving forward is that we are not out of the woods, and that the guidelines still exist, and the mask mandate still exists, and we continue to receive complaints. And so I would just ask that everyone would do absolutely everything they can to protect the public, but still to be able to operate a business and keep people employed. And I know that's challenging, but we are here to work with you on that. And then lastly, the pandemic metric tool that that VDH has been working on for some time is now public on the VDH website. This is a tool that we've primarily used to walk alongside school systems in their reopening decisions. We have shared that information with schools along the way. This Monday, there was a call with superintendents and health directors around the state to talk about how to use that data effectively in school reopening decisions. And obviously, there's a lot that we have to consider, right? As all the things we were just saying about heading into the winter season and concern for increasing case counts, we've got to make really measured and cautious decisions about the potential for kids going back to school as well. But we have to balance that against the reality that virtual schooling is creating challenges for lots of families. And so we want to figure out how do we ensure that the needs of those children are met, and ultimately, obviously, that's the school's decision, and we're here to help guide that process. Thank you.
Thank you, Dr. Avula. And before we go to questions, I just want to reiterate what Dr. Avula said. We should, as a community, I think, Dr. Avula, we should be lauded for, I think, people are wearing masks. We have been able to bend the curve and have that more in a downward trajectory as a community. You look at where our numbers are today and compare them where they were in the early parts of the summer, why we took certain measures and steps to slow things down because we had some serious concerns. We have to stay vigilant, though. These numbers look good today, but this can change overnight. On a basically just on a whim, it could change very easily. Clusters and outbreaks, these things could potentially happen, and that's why we have to be vigilant. We have to wear a mask. We have to keep our social distance, and we have to continue to wash our hands. All things I know that Richmonders can do. We've done it before, and we can continue to do it again. So with that, we'll take some questions. Yeah, we are very, very close in aligning. The question was about emergency child care. We did speak about one being open. We know we have partners with RBHA and YMCA as well. We are we also were able to launch the other institutions, churches, things of that nature who want to host as well. We are very, very close. We are still dotting some I's and crossing the T's. You saw that the school board is behind our efforts as well in terms of opening up the schools. So we're very, very close. I don't have any new information today, but we are on the brink of being able to open all 5 very, very soon. Do you think that you're going to meet that end of the month timeline, or are we looking for? I'm optimistic. Obviously, I'm optimistic. There could be an announcement tomorrow. It could be an announcement tomorrow, but like I said, we got to dot the I's and cross the T's. Believe it or not, this is a larger undertaking than it may look like on surface. We're not going right back to school. We're working with partners and the school board and the school board administration to launch something that we've never done before. And so I'm optimistic that something will be launched here very soon. Like I said, when you have one open already, we just got to dot the I's and cross the T's. I think that's still in the works. Oh, hello, Roberto. This man, he comes back to, in-person, interview, in-person briefings now, and he's like, monopolizing all the questions, If you can see what I'm seeing, there's not really a lot of people here, so.
So the only other question I had, RPD arrested a well-known Richmond activist this week, Christopher Goad. Police were executing a misdemeanor arrest warrant for obstructing free passage. There are concerns that have been voiced from some folks in the activist community about police seemingly targeting local activists. And I'm just wondering, are you worried about that as a practice or even as a sort of perception from folks in the community?
The question was about whether
Concerned that the activists have recently been arrested for very low-level misdemeanor crimes. And they're concerned that this is sort of targeting folks who have led the action recently. Are you concerned about that perception?
I can assure you that the Richmond Police Department is not targeting activists, journalists, you name it. That would be, first off, unacceptable. For me, that would be unacceptable, and that's not a practice I ever want to hear about in my police department. However, obviously, if there is a warrant or laws have been broken or anything of that nature, the police department has to do their job, and they'll do it in as respectful way as possible, but it cannot involve targeting for political purpose or anything of the sort, ideological purposes or anything of the sort.
The question was, for the 7 restaurants that we suspended permits on, what were the common themes that we saw? So they were all suspended based on the executive order around mask wearing. So, when the executive order came out, VDH was charged with enforcement of that. And we've largely done that in response to complaints. I mean, we've received thousands of complaints from members of the public. They all come into a database. Our staff vet every one of those complaints. Sometimes they'll see a complaint that says something like, somebody in the kitchen wasn't wearing a mask. Now, the way that the executive order is written, people in the kitchen who aren't public-facing don't have to wear a mask. And so we will vet the complaints based on what we see and read and decide to follow up if appropriate. If they are legitimate complaints, we follow up with a phone call and talk through. We send a copy of the executive order and the guidelines to the business. And then if we continue to receive complaints around that same institution, our folks will actually go to do an in-person site visit, document what they see. And then in most cases, we will address that with management and ownership and then come back for a follow-up visit. In these cases, in those follow-up visits, we did not see much movement or compliance, or sometimes it was an initial visit by the health department, but we have partners in ABC and other state agencies who are making their own visits. And so in some situations, we had documented evidence from multiple different agencies on multiple different visits. The main things, mask wearing by the staff. So we recognize that while we want everybody, all the patrons to wear masks, the medical mandate and the fact that if you come in a group, once you're eating and drinking, you don't need to be wearing masks. So there's a lot of nuance that the inspectors have to work through. But the employees do need to wear masks. So mask wearing by the employees. Serving from a bar was a big one. We continue to see restaurants served right at the bar. People would come up from their table and go to the bar. So that was a common occurrence. And the third one was not enforcing the physical distancing between groups. So even if you come in with a group of 6, if you're up and around and mingling with other patrons in that restaurant, we're going to ask you to enforce that not happen, that people really need to be seated, served at their seat by an employee wearing a mask.
Is 7 suspensions at this time low or good for the city?
It's the first time we're all doing this, Brendan. Sorry, the question was, is 7 suspensions good? Is that a low number? We have been working with restaurants for the last couple of months on adapting to these new guidelines. I think that we don't want to be suspending restaurants. We want restaurants to come into compliance. I hope that we don't have to do this in an ongoing way, but remember that this is both a public health crisis and also a complaint-driven process for the restaurants. So my hope is that we don't have to do this much more, but we certainly are prepared to enforce the executive order.
Forrest, did you have a question? You good? Chris, last question.
Trick or treating, yes or no? Guidelines about it? Is it canceled?
Here's the thing.
What do I tell my kids, Mayor?
The question is trick-or-treating canceled? Trick-or-treating is not canceled. However, my best recommendation is that we stay home. I feel like we're safer at home. We are trick-or-treating in a pandemic. And so I think I didn't mean to be cute about it, but there are innovative, creative ways now that we can celebrate Halloween without necessarily knocking on other people's doors. Here's the deal. I've had to adjust and adapt to the way I even campaign as a candidate. I'm normally used to knocking on people's doors every day and asking them for their vote. Can't do that this year because I feel like I, of all people, should be the model for public health, and I don't want to infect anyone. Who knows if I'm asymptomatic, or if they're asymptomatic. Even wearing a mask, I think we should put safety first. That's what I'm going to do, and I recommend everyone else do the same.
Thank you very much.
Thank you, everyone.
Guys.